Okay, let's get your questions answered. It's almost a Bible thick of emails, which is fantastic. So, given the response I had last week, I thought I'd do this again. Joining me from Canberra is once again Associate Professor Sanjaya, Senanayake, an infectious diseases physician at Canberra Hospital and also the ANU. Are you ready for your quiz, Sanjaya?
Absolutely, absolutely. Looking forward to it.
Thank you. Good on you. Great to have you with us. Should the sole adult or child be admitted to hospital if they're positive for COVID-19 and isolate from the family? What happens? When someone's infected, do they go home and mix with the rest of their family in isolation, or do they keep separate to the rest of the family?
Right, so if someone is diagnosed with COVID-19 and they're well, they don't need to be in hospital. They do need to isolate for a period of time. Now, if they're going back to their household, it's really important that they minimise the contact with the other members of the household, so use their own bathroom and toilet if that facility is available, have their meals separately, etc.
OK. The Chief Medical Officer has continuously reiterated that if you do not have the coronavirus, then wearing a face mask is not necessary. Is that where you stand? Face masks offer a lot more than they actually, what we think they offer. Am I right in saying that?
Yes, look, so the best situations, the most useful situations for face masks are if you are in hospital and you're going to see someone with COVID-19, they'll have a mask on, you'll have a mask on, or if you're at home looking after someone with COVID-19 and you have to have close contact with them. Wearing a mask just walking outside down the street is unlikely to be effective. And also with masks, if you don't wear them properly, they're loose, they're not particularly effective anyway, and some people get a false sense of security and don't wash their hands.
Yes, yes. Con wants to know, can you catch the virus in the atmosphere simply walking past someone?
No, so there are some viruses that can get aerosolized and hang in the air for a long period of time, but COVID-19 is not one of these. It spreads by droplet spread, which means if someone coughs or sneezes, it'll fall in little droplets about 1.5 metres around that person. But you can't just walk around and breathe it in normally. OK. One here from Linda. The infection figures are only relative to the amount of people who have actually been tested, and we can't tell how many people are out there carrying the virus. Is that right? There could be a lot more. Look, so I guess that does look at one issue, which is people who have mild symptoms haven't been tested, and people who may not have symptoms at all even though they're infected. And we're trying to work out how many people or what proportion of people those are. We've seen some studies saying there might be about 15%, others saying much higher, over 50%, but it's hard to know. So, yeah, it's a watch this space place.
OK, Jason wants to know, a total lockdown will only be necessary if the general public continues to disregard advice. Would that be one of the reasons why they bring in the lockdown? Not because we're not making headway, but because the community-to-community infections are continuing because people aren't self-isolating.
Exactly, and I think the current set of circumstances we're in is because of what we saw at Bondi Beach, etc. And the whole idea is don't mix with people. If you don't mix, you minimise the risk of infection. So if people are continuing to mix despite all the pleas from government and health officials, then it'll probably go to the next level because of that.
All right, Sanjaya, I've run out of time, but I've got plenty of these emails, and I thank all the people who've sent them in, but you've been most helpful in answering some of those questions. Thank you.
Pleasure anytime, Chris.
Good on you. Good to have you with us.